Hello, welcome to today's Here's to Your Health podcast. I'm Don Lintzman, your host, and my guest on the podcast today is Sara Gaul. Sara is the Population Health Manager here at CCMH, and Sara, thank you for your time today.
Thank you for inviting me.
We're going to talk about diabetes here in a second because November is National Diabetes Awareness Month. But before we do that, I want people to know a little something about you and about your background. So why don't you tell us about your experience in healthcare, because I think you've got a fair amount of that.
Yes, I've been in nursing now for about 24 years.
What's that all?
I am an RN, and I actually have my master's degree as well. I've been here at CCMH for almost 11 years now, with a big focus being on diabetes education and advocating for patients in that realm.
And I think we've seen a lot of success in that area over the years, and we work with a couple of endocrinologists out of Omaha. So why don't we talk about that for a second too?
I am the nurse also for Dr. Island and Blount. They're at the University of Nebraska Medical Center. They do clinic here the first and third Wednesday of every month via telehealth. Don't let telehealth scare you. A lot of patients don't quite know what to think about that. But in reality, endocrinology is not a lot of hands-on, other than yearly foot exams that people with diabetes should have. It's a lot of looking at blood sugars, talking about medications. It actually works really well, and it saves a lot of our patients' trips down to Omaha for appointments.
Right, and diabetes as well is about diet, exercise. It's a lot of lifestyle sorts of things.
It is, for sure.
And that's why we want to talk about this today,
Yes.
because I think diabetes is one of those things that if we pay attention to it, we can do something about it. But let's start by talking about what diabetes actually is.
Well, to keep it very simple, it is a chronic disease where either your body can't produce enough insulin or use it effectively. If we're going bare bones explanation, it's about insulin.
So when we talk about diabetes, we know that there are a couple of different types, but let's talk about what those types of diabetes are and what makes one different than the other.
They are very different. Yes, there's quite a few subtypes of diabetes now as well that are very rare, but when you look at generally there's two types, type 1 and type 2. About 90 to 95% of cases are type 2 diabetes. This is generally adult onset. Type 1 diabetes is about 5 to 10%. We tend to think of this as diabetes that children are diagnosed with, but you can get type 1 diabetes as an adult too. The big difference is type 1 diabetes, the more rare one, 5 to 10%, is about your body has destroyed its ability to make insulin. It's an autoimmune disorder, so it's similar to like rheumatoid arthritis, celiac, in that it's autoimmune in nature. There's really nothing you can do to prevent type 1 diabetes. Type 2 diabetes, 90 to 95% of the cases, there are some factors that people can impact, such as weight, activity level, the way that they're eating, and some that you cannot. Really, your age. As people get older, their chances are higher. Genetics can play a role. Type 2 diabetes does tend to run in families. And even ethnicity. Certain ethnic backgrounds do have a higher incidence of type 2 diabetes than others. So there are modifiable and non-modifiable risk factors for type 2.
Yeah, I know we've talked about this before, but I have a lot of diabetes in my family on both sides. And that's the reason why I'm very cognizant of where am I at with my blood sugars, because it doesn't take long for this particular kind of disease to develop.
Very much so. And when you look at those modifiable risk factors, people ask, what can I do to prevent type 2 diabetes? If I know that maybe it runs in my family, or maybe I'm a little overweight, smoking is another risk factor. What can I really do? They've done a lot of studies on diabetes prevention, and even a 7% weight loss can have a huge impact on preventing that kind of shift from pre-diabetes, or borderline diabetes is what people used to call it, into diabetes. And diet can have a big impact on that as well. And then exercise, shoot for 150 minutes a week. It does not need to be strenuous. I'm about to fall over exercise. We're talking about a brisk walk where you get a little short of breath. It might be hard to talk in full sentences when you're walking at that rate, but averages out to about 30 minutes per day most days of the week.
My guest on the podcast today is Sara Gaul. We're talking about diabetes. Sarah's the population health manager here at CCMH. And you mentioned a couple of different symptoms for diabetes. Well, let's talk about that just a little bit more.
Well, for type 2 diabetes, the hard thing is there are a lot of people that have type 2 diabetes that don't know it. We normally don't have a lot of symptoms of what we call hyperglycemia or high blood sugar unless it gets well over 250. For reference, people should wake up in the morning with a blood sugar under 100. So, quite a bit higher than maybe what the norm is before people have symptoms. So, as far as diagnosing type 2 diabetes, get your annual blood work. Get a fasting blood sugar. That's part of like the community wellness that we do here or even with your provider. When people do have really high blood sugars, like above 250, or these are the symptoms that patients with type 1 diabetes, the autoimmune type that we talked about, when your blood sugars get really high, you're thinking of being thirsty all the time, almost like a thirst that you can't even quench. You're just so thirsty. Frequent urination. You're also urinating a lot more than what you would consider usual. And then rapid weight loss. Those are all symptoms to be looking for in adults, but especially parents with young children. If you would notice that your child is all of a sudden losing weight, thirsty all the time, urinating, those are definitely symptoms that don't mess around. I would get them in to see a provider right away. If that would go a step further and have nausea, vomiting, stomach pain, that's kind of signs of an emergency, what we call diabetic ketoacidosis, and that is like an emergency room thing. So again, those are more signs for type 1. That just tends to be more rapid onset than type 2.
So we've talked about diagnosis, we've talked about symptoms, but what about treatment? How is diabetes treated?
Diabetes is treated depending on the type. With type 1 diabetes, it's insulin. With type 1 diabetes, the patient's body is no longer making insulin or near enough, so you need to go right to insulin. Type 2 diabetes, we're looking at medications and lifestyle, and your provider would figure out what's best for you. It would depend on how high are your blood sugars, what does your average blood sugar look like, and then they would determine if you could try lifestyle management, meaning diet, exercise, for a certain period of time, or whether you do need medication and or possibly even insulin, depending on where you're at when you're diagnosed.
I want to come back around to reducing the risk of diabetes, because I think here at CCMH, for sure, we have some things built into our program that allow us to help people to identify whether or not their blood sugars are high.
Yes.
So 4 times a year we do our community wellness event. We have another one coming up at the beginning of December 3rd and 4th, from 6 to 8 a.m. both days. It's a fasting screening, but we do a bunch of testing there. It's $45.
Yes.
$45 is all it costs to do this. And you can actually go online to ccmhia.com and go make your own appointment one of those 2 days. But we do some things once we get those results, Sarah, and maybe that's the thing that I want to talk about today.
Patients, if you come and do a community wellness, you will get a copy of your wellness results, as well as kind of a letter that will show you if certain things are out of whack, are not normal. And so blood sugar is one of the things that will be on there. Under 100 is normal, so you can be pretty sure you do not have diabetes if your fasting blood sugar is under 100. Once you get to like 100 to 124, 125, that's considered pre-diabetes. And if it's over 125, that is where we would possibly diagnose diabetes. Now, we don't like to diagnose diabetes based on one fasting blood sugar. So that would be a reason to get an appointment with your provider, and they'll either run another test, an A1C, which is kind of a 3-month average, or have you repeat the fasting blood sugar on another day. Technically, it requires 2 blood sugars of 126 or above to make an official diabetes diagnosis.
So before I let you go today, I want to talk about just one more thing, and that is, what kind of services do we have available? We've talked about the telehealth with endocrinology.
Yes.
And we've talked about wellness. What other services do we offer that diabetes patients might be interested in?
Yes, CCMH patients can see me for basic diabetes education. I'm happy to do that. At this point, we do not charge for that. it is a free service to patients of CCMH at this point in time. So if there are patients out there who have diabetes, even if you've had it for years, but you'd like to sit down and talk more about it, I would be happy to meet with anybody. And also, if patients are newly diagnosed, the providers are pretty good at offering that to them. But if you didn't get that offered and you would like it, you can definitely reach out to the clinic and request an appointment with me.
Yeah, so give us the phone number so that people know who to call.
Our main clinic number is 712-265-2700, and you would just let them know you want to talk to Sara Gaul, that's me, or schedule an appointment.
Or you can go online at our website. On the front page, there is a place where you can send us an email. And you just send us an email and say that you'd like to talk to Sara, and we'll make sure she gets that and she gets right back to you.
That will be great.
Any other information you want to share today, Sara?
No, I think we did it. We kind of got a great conversation about diabetes. So.
Yeah, and I think it's really important, for people like myself who have been aware of this for a long time. I had an uncle, my Uncle Elmer, who was he's a great guy. But he had diabetes and he owned a bar. That's a bad combination.
Right.
Because he drank a lot of full diet sodas. He ended up having both of his legs amputated below the knee.
Yes.
And so that was a very instructive lesson to me as a young man. I don't want to be like that.
Right.
And so I think it's what we're trying to do today, both education and awareness. Make sure people understand what diabetes is, but then also make sure that they have that on their radar screen and they start checking and making certain that their health remains 100%. But the best way we do that is to understand what those risk factors are that you've talked about, and then make certain that we do something about that.
Well, and that's, I think it's important for everyone to realize when you think about the complications of diabetes, you hear of people that have amputations, that are on dialysis, lose their sight, even heart attacks and strokes. Those complications come about from uncontrolled diabetes. So the best thing you can do if you have diabetes is manage it well, because if you can keep your A1C at that goal of around 7, your risk of those complications is much, much less than someone who is not able to control their blood sugars and have much higher. It's that high blood sugar that causes the damage. And so by keeping them down in normal range, your risk of those complications is dropped dramatically.
If you've been listening today to the podcast and you'd like to see Sara personally, give a call to the CCMH Medical Clinic, 712-265-2700, and we will get you on her schedule. Sara, thank you so much for your time today.
Thank you, Don.
Sara Gaul's been our guest on the podcast today. We've been talking about diabetes awareness because November is Diabetes Awareness Month. Sara is our Population Health Manager here at CCMH. And I'm Don Linsman, your host for the Here's to Your Health podcast. Thank you for listening. Have a great day.